Hi, Dr. Garvey from Allergy Breakthrough Center here today, talking about gut dysbiosis and inflammation. Really, it's the link between gut health, dis-ease, and disease that we'll be talking about today. Many of you know I am the owner and operator of Allergy Breakthrough Center. One of the things that we look at to see if someone is having any inflammation from different organ systems is looking at the gut. Often people are coming in for symptoms of allergies and sensitivities, histamine intolerance, mast cell activation syndrome, as well as a melee of digestive issues, respiratory issues, dermatological issues, tons of mood disorders, and cognitive dysfunction, the spectrum disorders, right? It's just different organ systems that get inflamed, and then they put an itis, after the organ system or organ that is inflamed. So that's where the itis comes from. So anytime you see that, know that that just means inflammation of that system or organ system or pathway. But today, we're going to dive a little deeper into gut dysbiosis and kind of see, like, hey, what can I do to help these things? So when people come into the office, I offer advanced allergy therapeutics. So if someone's having a hyper reaction, a hypersensitivity to a stimulus, we can check over 85,000 different types of stimuli with the amazing advanced allergy therapeutics technology, which I've never, still to this day, have never found anything even slightly comparable to that technology. Stimulus response, if it is a conditioned response, my body has learned to interpret and have an overreaction to, dust, a pollen, a specific food, an environmental, a chemical, different stimuli like barometric pressure, even, or sounds, or even emotions, where I'm feeling something way more hyperactively or having a hypersensitivity to an exaggerated response than Sally or Joe. And that's the difference with the AAT technology, is that literally can be easily addressed within minutes, and you're done, and you never had to go down a different path, and there isn't gut dysbiosis, and you're healthy. um, and one doesn't mean you can't have the other either, but a lot of cases people come from all over the country to get something, for instance, like dog or cat treatment or horse, and they can be by a horse or a cat or dog, usually in one treatment. So after we do an assessment, we find out what those components are. You can be by that stimulus without the XYZ symptoms associated with that stimulus, you know, within 24 hours. So we just say to avoid it. But when we're looking at inflammation and or a root cause, hey, what's driving that pathway, what's driving that dysfunction, that symptom, that disease, then we look a little bit deeper. And depending on the person, of course, everybody's an individual, everybody has their own individual issues and organ systems. Of course, you can see patterns, but truly, there is no one size fits all protocol. A lot of doctors and practitioners may, of course, in medicine as well, conventional medicine, hey, you have this, we give you this medicine. But that's the difference with root cause functional medicine practitioners. We don't do that. Of course, you can see, oh, if you have a histamine issue, of course, certain things can help histamine and calm the mast cells. But in general, it is an individualized, customized approach I do specifically for every single person. And that's what is really truly the difference of you getting well or not just doing some blanket, statement. So, I mean, any layperson in most states can say, hey, take this multivitamin, right, without any training at all, and just give you a recommendation. Of course, right, multivitamins, all these things are over the counter, but I always say the most expensive thing you spent money on is the supplement or the lab tests, that you didn't need. Some of these tests and supplements, they get pricey. How do you know how it's effective? I know we all have our drawer full of different supplements that we've tried, and it's not so easy to see, hey, XYZ went away because I took this one thing. Also, because they're small amounts and it takes a while to build up in the system. But in general, right, we look, we test, We don't guess, and we find out what the root cause is, and then we use those measurements and whatever lab we needed to as an outcome measurement, right? To watch the progress, whatever anyone is doing, pharmaceuticals, supplements, herbs, a treatment, treatments are treatments. There's many different treatments, but to see the effectiveness of something, right? That's when we test and we retest. But let's dive into some information so that you can get some help that literally you could start using today. Okay, so we're just going to focus on like gut health. What is the gut microbiome and how does it affect the immune system? I mean, literally, it's 70% of your immune system is in the gut. So it's incredible when people think it's, some other system and it's mysterious, but it's the gut. Signs of an unhealthy gut, chronic disease, linked to poor gut health. Most people have heard these types of things, but we're going to just touch on a few things and hopefully you can get something out of it today that can really help you. And of course, I mentioned it at the end, but I'm happy. I mean, it's literally my life's mission to be able to help get another set of eyes, but to guide you. So I was constantly having issues since I was a child, um, on spastic colon medications back at 6 and 7 years old, all the way through. I had, IBS and all kinds of issues. But my goal is to not have decades of suffering for you, even weeks, because there are many things that you can do to help, right? It's just so many people are doing things that may sound great, but at the time, especially if you're in a flare, certain things that seem logical should not be implemented at that time. And I was doing that even as a doctor and I didn't know. So now I know and I try to help as many people as I possibly can. But I do have the honor of being New Jersey's favorite kids doctor for this, my approach with my holistic therapies and functional medicine at my allergy breakthrough center, where I offer advanced allergy therapeutics technology. I offer neurovagal evaluation and rehabilitation if like your brain is literally running the show in form, basically telling the body I'm in a stress state all the time. And then different things that are coming into my sensory systems, I'm having a hyper reaction to. That's a neurovagal assessment with neurovagal rehab. Very easy at home stuff that really can balance the brain quickly. It's a lot of it you can learn about too at the Brain Balance Centers of America, but I do it at a fraction of a price of that. And then I also offer, I'm a doctor of chiropractic by training. I've been a chiropractor for 27 years now. Wow. And of course it's a holistic mindset, but it really is going, hey, there's something else to your symptoms, right? That's what helped guide me, because I was having so many issues and allopathic medicine just literally dismissed me, unfortunately, for years. And I mean decades of my life, over 4 decades, that basically, especially as women, we're often told, it's stress, it's emotional. If it's resolves quickly, it was emotional. If it's more chronic, they say it's stress and anxiety, and they may even prescribe certain medications like Ativan or an antidepressant. And you know medicine has its place, but truly, I mean, even the mental health, some of the top mental health experts say there isn't a psychiatric case that doesn't have some part in the gut, because we are producing most of our neurotransmitters in the gut. So that's our serotonin or dopamine, the ability to not be depressed, to self-soothe and be happy, is actually regulated in the gut. And I know I didn't know that while I was going through chiropractic school. I learned that in functional medicine. But let's dive into it a little bit deeper. If you have any questions for me, again, I always offer a 10 to 15-minute free clarity call for anyone interested. If I could just talk to someone and shed some light on it, I'm happy. Right. If you don't work with me, that's okay. Of course, I want to work with you. I want to help as many people as I possibly can. But getting and not just accepting, oh, you're a victim of your genes, or hey, your labs look great, but something is going on, right? This was me. That's why I feel truly a true mission to be able to do this, because I was just so dismissed. Your labs are normal. It's all in your head. Take an Ativan. Um, I don't like that. So I'm here to help in any way I can. Okay. So again, gut health goes way beyond digestion. It influences your energy. It's truly your guts, your second mind, right? And it's literally your immunity. But it is considered the second brain due to the broad impact on the body. Understanding how it functions is crucial in maintaining long-term health. Even I believe it's 90% of your information that's going to your brain is coming from your gut that goes to your brain. So you think your brain's telling your gut what to do, but it's really, most of it is going towards the brain, not from the brain to the gut. So it's telling the brain, hey, this is what's happening down here. And then the brain controls the biology accordingly. But when we, have some type of dysbiosis, an imbalance of good bacteria and bad bacteria, and that loss of diversity, and you may have like overgrowth of certain bacteria, and we can test for this to see and not just guess, right? But you can see sometimes that this can lead to all kinds of issues, not just immune, energy, or mood, but truly autoimmune issues as well. So it's not something that I take lightly at all. um, but what is the gut microbiome? The gut microbiome consists of trillions of microorganisms like bacteria, viruses, fungi that live in your digestive tract. These microbes play a crucial role in breaking down food, supporting the immune system, and producing important nutrients like certain vitamins and short chain fatty acids. Maintaining a diverse and balanced microbiome is essential as it helps protect against illness, improves digestion, and supports overall health and well being. And really, truly, it's the ability to break things down properly, right? As soon as food goes into our mouth, we're breaking down the carbs and sugars with the salivary amylase. As that food goes down our throat and hits the stomach needs to be a pit of acid so that I can actually break down my protein. That food is being broken down in there. And then if there was any bacteria or anything that was on there, my pH of my stomach should be between 1 and 2, and it should be pure acid so that it can actually kill anything, and it doesn't live to survive that stomach acid and create an inflammatory and or infectious state in my gut. So that's really important. That's like one of the big root causes. So making sure we're breaking down that food, right? And then as that protein leaves, that's that big ball of food is called chyme, and then it goes towards the duodenum, and there the gallbladder secretes the bile that's produced by the liver. So the gallbladder sits right on top of the liver on the right side, and the body senses the fat in the food in that ball of chyme, and then secretes the amount of bile needed based upon the fat content. So we can see in certain testing, hey, are you breaking down your fats and sugars and carbs properly? Are you having any undigested food in your stool? That's not normal digestion. Something's going on. That should not be happening. That's not normal. And then, of course, the transit time from getting from my mouth to my anus, should be about 90 minutes. So, of course, give or take, right? All the IBS, irritable bowel syndrome, C means constipation, D means diarrhea. So, a lot of people, including myself, were diagnosed with IBS, C or D. Sometimes it's combination, but that's what often we're told, take polyethylene glycol, which is Miralax. This is for constipation, and then fiber to help bulk the stool. But it's more than that. There's way more than that going on. It's not just here's some Miralax and everything's normal. But that's why we do additional testing. And then, of course, looking at the mucosal layer, because it's mucosa, from the back of your nose is the back of your throat all the way down to the anus. So there, that lining there, when that mucosal layer thins, right, tight junctions in those cells that align that loosen. And then different things like undigested food, because we didn't break it down properly, different toxins that are being produced in the gut, especially if there's constipation, right? We have fermentation and putrefaction of the food. It's literally rotting in our guts, right? I've got a rotted gut, people say. Some people have really stinky, foul smelling gas, and some it just does smell like anything. That's different bacteria that produce those gas, but that gas can, be one of the bigger causes of IBS. And somebody might see it as belching, somebody else might see it as flatulence, but it's still, if it's extra, we shouldn't be having that. We should be having proper digestion. But if any of those toxins or any bacteria, of course, we're more bacterial cells than we are human cells. It's 150 to 1 ratio of, we are literally more bacteria than we are human genes. But if those bacterial fragments or undigested food or different toxins actually can get through those mucosal layer, because it's thinning and there may be little tight junctions that loosen and things can get through, that's a leaky gut, right? So that's intestinal permeability, but aka leaky gut. And when bacterial toxins cross into the circulation, they literally sound the immune alarm. So, and it's called inside you, toxemia, toxins in my blood, right? So there should not be toxins in the blood. That's a sterile environment. So that's where immune chaos happens. Okay. There's so many things we can do to help maintain a diverse and balanced microbiome. Of course, eating good food and not just processed junk, which is the sad standard American diet. But of course, tweaking and giving you exact things to eat is wonderful, because then you know exactly what to eat and what not to eat. And that's what I help you do. And I am not a limiter of food. I love food. I don't want any limits on food. I had over 113 sensitivities when I was tested with the advanced allergy therapeutics, and I was eating very few foods without a reaction. And now I literally eat everything. There's nothing that I don't have. And I had full psoriasis, full rosacea, full eczema since I was 2, IBS since I was 6. Um, I had a leaky gut. I had tons of bacterial overgrowth. But those were driving my reactions. And my symptoms, which were very bad. And I got down into the 80s, and I was 86 pounds when I was 30 something years old. So I was very unhealthy, and I tried everything. And this was after I was a chiropractor. So I went into chiropractic school to help me. And of course it helped me, but it didn't fix my gut. And that's why I'm a forever student and always looking to help others with the knowledge that I've gained over the years. Okay, so let's go to the next slide. Gut health and the immune system. Again, the significant part of your immune system resides in your gut, making gut health essential for strong immune defense. A well-balanced gut helps the immune system distinguish between harmful invaders and harmless substances, reducing the risk of unnecessary immune responses, right? When the gut is out of balance, it can trigger chronic inflammation and make the body more vulnerable to infections and illness. Supporting gut health is a key step to maintaining overall immune resilience. So I hear a lot of people say, oh, my kid's just sickly. My kid's super sensitive. He just gets sick all the time. There's a gut issue, right? Of course, there can be a primary immunodeficiency, but it's not common. We can test for it as well. But most of the time, of course, it starts in the gut. But chronic immune activation literally can spread out through the body if there's a leaky gut. And that's systemic inflammation. So it can show up in all types of different conditions and symptoms. So, don't just stop at, be a victim of a condition that's been placed upon you, or, oh, my mom had this, so that means I'm going to have it. That's not true. There's genetic predispositions, absolutely. And you only have to do a gene test once, right? So you're never having to do a gene test twice. You find out if there's pathways that need support. Like, hey, there is a pathway here. I can't, process things properly, like MTHFR, COMT, different things that can lead to certain predispositions, but it doesn't mean that that disease or those conditions or issues may actually be show up for you, right? But when we're looking to look at the root cause, these are the things we're looking at so that we can support what needs to be supported, right? But different conditions that are associated with gut health, of course, immune dysfunction, but fatigue and low energy. I mean, how many of us have fatigue and low energy? And we're thinking, it's maybe a nutrient deficiency, but it could actually be like inflammatory signals from things that are circulating in your blood that should never be there, right? And your body's trying to respond to this. And then some of these bacteria and different toxins actually can disrupt your body's cellular energy processes, and you can't make enough cellular energy. And a diet, a good diet absolutely helps, but it's not going to fix it. A diet is a tool. It is not the corrector or fixer of something. But if there is a leaky gut, these what are called lipopolysaccharides, LPSs, and we can check for this to see if they're actually there or not, so it's not just a theory. But they activate the immune cells, right? And then they these immune cells in the brain as well, and they can disrupt your serotonin, they can disrupt your dopamine, and here comes, hey, why am I sad? Why is my kid depressed? Why is my kid have these certain spectral issues, right? Because with these come the different labels, ODD, ADD, ADHD, that are often associated with these, because often there will be a nutrient imbalance when these things happen as well. It's not just, hey, you have immune dysfunction. It's this cascade of things that can actually happen, as well as put the immune system on constant high alert, right? Creating further cyclic cycles of further inflammation. And then, of course, any skin issues. I mean, this is who comes into me, these kids with eczema, adults, eczemas, all kinds of different highs, right? Mast cell activation syndrome. But I had psoriasis, I had eczema, I had all these issues, that acne, of course, joint pain and chronic inflammation, right? I've been a chiropractor forever. Sometimes that there's literally something happening in the gut that's promoting that chronic inflammation, because you can feel that the joint is not misaligned often, and yet they're having this systemic inflammatory response, and everything seems to hurt. And one day it's this and the next day it's that. And of course, right, weight gain, everybody goes to the GLPs and, give me a quick fix. Yeah, who doesn't like a quick fix? But they come with their side effects. I mean, blindness is one of them that they're talking about. I, Everybody wants a magic pill. Every one of those magic pills has a side effect. You see the commercials on TV, ask your doctor for this, this, and this, but here's the side effects. So the same amount of time they're talking about the positive thing is the same amount of time that they use to tell you about the negative. So it's always everybody's choice, but I just say make an educated choice. That's why I try to get a different set of eyes. I'm not trying to convince anybody of anything. I'm just trying to educate, because I didn't know, and I wish I did. And that's truly the reason why. But metabolic syndrome, which leads to insulin sensitivity, which can lead to type 2 diabetes, and of course, weight gain. And then once we have those conditions, right, we're still in preventative stage. Once we have those, we become more in maintenance stage, and of course, prevention of further issues. But once you burn out your pancreatic cells, right, there's not much we're doing for that. But hormone issues, of course, thyroid, right? Thyroid and adrenals get hit the hardest when there's a leaky gut, because it's a small tissue and it has a small affinity for toxins, and it gets uh, hit the hardest. But again, autoimmunity, continuous immune activation that literally confuses the body, and the immune system can start attacking its own tissue. But and then the frequent illnesses and infections, especially in these kids. I had a kid come in literally strep throat 6 times in 5 months, and it's just, and every time they threw amoxicillin at it, the pediatrician. So, no fault of the pediatrician, but look a little further, ask a few questions. The parent didn't even change the toothbrush, right? So these are certain things, that we might think are common sense, but we're all busy. And sometimes, a parent doesn't realize that they didn't change it or didn't think about it or thought, putting some rubbing alcohol would fix it. But what's activating that, right? So pandas, of course, is associated with strep, and the treatment is antibiotics. I've met people that have been on antibiotics for 15 years. I mean, antibiotics, they have their place, but it's not the approach. There's something else happening if you're on antibiotics for 15 years. But that dysregulated immune system that can't properly defend against real threats, that's what you have to focus on, right? And that's what I do in practice. So, um I'm not for everyone. I'm just here for education as of right now. This is what I'm doing as a public service. This is not any recommendations. No one here is my patient. I'm literally just trying to help people shed a light on certain things. Okay. But signs of an unhealthy gut, of course, you can, may more than just digestion. Of course, we think digestive stuff, it's our gut. But again, the irregular bowel movements and bloating and all that. But fatigue is huge, right? Chronic fatigue syndrome. I mean, it's epidemic. Everybody's getting diagnosed with chronic fatigue syndrome. They come in CFS, I have. But frequent illnesses and even skin problems when you're going to the dermatologist. I mean, literally, they're like eczema, dermatitis, inflammation of the skin. What's causing it? That's the point. It's just so frustrating that they just leave it as that, and it's steroids, right? I was on this stuff since I was 2 years old. Corticosteroids, yeah, they have their place, but that is not the long-term treatment for a condition. Acute, yeah, if needed, right? I did it, but it does lead to a leaky gut. Corticosteroid long-term use leads to a leaky gut. It's proven. But focusing on, even again, the gut brain connection, that you may not think that it's coming from your gut because it's in your brain and you actually think, oh, I need mental help. I need to see a therapist, right? Because everybody's specialty compartment. We're not a compartment. This is one being with the organs inside of here. Just because the doctors are specialists in different compartments doesn't mean that we're compartmentalized. Every tissue, every cell responds in literally in a wave in milliseconds to a thought. There's no compartmentalization there as far as one thing not affecting the other. But just knowing that the whole enteric nervous system, there's over 100 million neurons lining your gut. It's in constant two-way conversation with your brain. It's like, hey, something's here. 100 million neurons in your gut. And again, those neurotransmitters production occurs in the gut. Microbes will create serotonin and dopamine and GABA, gamma aminobutyric acid, which regulate your mood, sleep, and focus. So what do we do for sleep? We're taking an OTC or Ambien. My poor dad was on Ambien for 50 years, right? So, and then you become addicted, then it doesn't work as well, and it has memory loss issues. I mean, I know many people and patients that they're having a hard time recalling, and this is from the use of Ambien, right? So everything has its place, but to be a long-term treatment, there's way better things than that. But up to 90%, that's what the quote is, 90% of serotonin is made in the gut. So disruptions in the microbiome can directly alter mood, resilience, and emotional balance. And I don't think a lot of people know that, but that is literally the truth. And then endotoxemia, which I talked about, which actual toxins can get into the blood, but they can get into the brain. So there's tons of peer-reviewed journals, medical journals, that literally show toxemia's effect on the brain. So they say leaky gut equals leaky brain. But bacterial toxins, those lipopolysaccharides, cross into the circulation, systemic circulation, activate the microglial, the immune cells in the brain, and create brain fog, fatigue, anxiety, depression, panic attacks, mood disorders, etc. So it's not, hey, let me will myself to a better brain, or something's wrong with me and you take it personally. That's one of the big freedom things, is it's not a personality disorder. It's literally coming from your gut. So no, it's not you, your brain, it's your gut in almost all instances. Okay. Of course, there's genetic predispositions to certain things and hereditary things, but in general, look to the gut first. And of course, test. I check neurotransmitters all the time. We can see these levels. And whatever anyone wants to do, whether it's medications or whatever way we want to go about it, with food or with supplements or herbs or homeopathics, there's help that is very safe that you can do with very tremendous results that you can actually measure. And of course, I do neurovagal assessments, but the gut brain axis via the vagus nerve, right? So stress, dysbiosis, and inflammation in the gut send the alarm signal straight to the brain. And the vagus nerve is what keeps you in rest and digest. So it's a cranial nerve, and it controls the blood flow and my autonomic nervous system that is that's responsible for digestion and assimilation, rest and digest, versus fight or flight. Fight or flight, the blood's going to my arms and legs, and I don't need to think or digest. I just need to act. But most of the time, we need to be in rest and digest so that I can interpret my world in a relaxed state and not in a fearful flight, fright, or freeze state, because then nothing's getting assimilated properly. Okay. And by the way, as far as antibiotics go too, of course, everything has their place, but stress and antibiotics literally disrupt the gut, and chronic stress can mimic the microbiome damage of antibiotics. So antibiotics are like an atomic bomb. They kill everything. They kill the good guys, they kill the bad guys. We need them when we need them. I've taken multiple antibiotics most of my life. But again, there's a good and bad to it, right? But they fuel that cycle of dysbiosis and mood instability. I had fixed my entire leaky gut. I had a horrible infection that needed antibiotics, and I took them. But it created a leaky gut again, which I tested and saw, and I had to work on my gut again. So we're not a victim. Once we learned how to do these things, we know what to do. So it's not that, hey, you fix something once and forever until you die, until you're 100 and something years old, everything's works. No, it can get disrupted again, right? We can go out to eat, we can get food poisoning, we can have to take an antibiotic, certain vaccinations can cause issues. There's tons of things that can cause drug use, alcohol use, chronic stress issues, metabolic issues, right? So stealth infections that can cause these issues. But research suggests that gut health may be connected to many chronic conditions, including metabolic, inflammatory, autoimmune, neurological disorders. A disrupted gut microbiome can trigger inflammation that affects other organs over time. And that's what we can see on these advanced testing that we use with functional medicine root cause approach. So luckily, being a functional medicine certified practitioner, I'm able to, and my doctor's license, I'm able to order a lot of tests that other practitioners might not be able to order. Uh, Often, primary driver is insurance, that they won't cover it. So a lot of doctors won't even tell you about these tests. But some of these advanced tests, I mean, for $200-$300, you can see dozens and dozens of markers that can show you literally what's going on. The best that any lab that I've ever seen ever. And you're shocked sometimes, where you can literally point your finger and go, there you are. And then do a treatment and see that it's gone. So there's nothing more pleasing to me than symptom relief, resolution of the gut issue, and then the symptoms XYZ that were associated, or the disease or dis-ease or condition, is no longer a condition. So it's fantastic. But also, I'm 53 now and in menopause, and weight and metabolism and estrogen balance and progesterone testosterone balance and all these different things, men and women, that we go through midlife. The gut has a lot of control over this. So just estrogen balance in general, right? Microbes regulate estrogen clearance. Like, I didn't know that before. And imbalances can drive PCOS, right? And PMS symptoms and fibroids, which I've had, and I didn't know these things, right? So, but blood sugar and appetite, GLP-1s, right? um, they regulate hunger, cravings, and insulin sensitivity. You can see on certain tests, you can actually see certain bacteria. And if certain ones are high, it literally tells you this type of bacteria will literally grab your calories, steal them when you need them for energy, deposit them in your fat, and you get heavier. And you're like, wait, I'm doing everything right. What the heck is going on? Sometimes it's an overgrowth of those microbes. And no one, and we're sitting here blaming ourselves, right? Thinking it's something that we're doing, or it was that one cookie that I snuck, right? And we're beating ourselves up, but it's actually gut health, right? So that's what dysbiosis, the good guys versus the bad guys. Hey, there's more of this guy, there's more of that guy, but we can get them back in balance, and we can measure and make sure that they're there. But, the microbiome literally is a control center for your metabolism, right? Your energy, your hormones. It supports cortisol, right? And balances and gives you stress resilience so you can handle more stress. It's influences your thyroid, excuse me, and your T4 and your T3 conversion, and your mitochondria and energy production, right? So again, estrogen metabolism, cortisol, thyroid, insulin sensitivity, ghrelin, appetite control, your GLP-1s, and then of course supports body composition and metabolism again. So, and the ability to get these things out of the body. Okay, so different things that we can do to help. Everyday factors like, again, chronic stress. Be mindful, right? There's certain things we can do. And I have health coaches that really can drastically help you with 24/7 tech support. That's super easy. And when you need help, they're there for you. So that's an option to have with that I provide for my patients. But poor sleep, right? Getting real quality sleep and not just knocking yourself out with a pill, especially these antihistamines and things that people take, it just wreaks havoc on pathways. But lack of physical activity, right? Get up and move, and frequent antibiotic use, as well as steroid. I was on this stuff forever. Can negatively affect gut health. Remember, even for the pets, the biggest things prescribed are antibiotics and steroids. It's the same thing for us. It's antibiotics and steroids, antibiotics and steroids. And then, of course, it's all the other drugs. But in general, you have an overgrowth, I give you an antibiotic. You're in a flare, here's a steroid. And it has its place, but it's not a treatment model for long term. But that's what we do in the United States. So these habits disturb the balance of the gut microbiome, reduce immune strength, and contribute to inflammation throughout the body. And maintaining a healthy lifestyle with regular exercise, good sleep, stress management, mindful medication use helps support a resilient gut and promotes overall health. I thought this was so exciting. I just put this in here because just in December here, 2025, the Nobel Prize in Physiology or Medicine was awarded to Mary Brunkow and Fred Ramsdell and Shimon Sagaguchi for their work on the regulatory, they call them T reg cells, regulatory T cells and immune tolerance, and showing in the gut that these cells control the T cells, the naive T cell determines the message sent. It's either tolerance of this food or substance, right? Or attack, what's getting through those endothelial cells in the gut lining. And depending on the biome, and if certain circumstances are there, like it's favoring a good not dysbiosis, but proper gut health, then it will send tolerance. If there's alert to go, no, there's this isn't a good biome, right? This is where your plate gets smaller, you reacting. This is like the histamine intolerance. This is the mast cell activation. This is the tons of food allergies. This was part of my issues. But now they proved it, and they can actually measure these things. But they can, it'll tell the body to turn on the cells that attack. So they literally proved it, that this is literally how these issues are happening. And this is how autoimmune happens in a lot of cases, because it gets out of control and it starts sending tons of signals, and it can mistake our own tissue for actually something that like an antigen that the body should attack, but now it's our own tissue and it starts attacking our own tissue. But trillions of microbes live in the gut, sending constant signals, and 80% of those messages go from the gut to the brain, not the other way around. I think I said 90 before, but it's 80% of those messages. And that's from metabolic research. But how to improve and maintain your gut health, really, right? It's easy once we know what's going on. So general, again, this is general education. Maintaining a healthy gut starts with eating a variety of whole foods, particularly those high in fiber, right? Because that's what's going to give the good butyrate production for the good environment. Like fruits, vegetables, legumes, whole grains, right? Like whole foods. These full foods nourish beneficial gut bacteria and support digestion. Regular physical activity, stress management, and quality sleep also play vital roles in gut health. While probiotics and prebiotics can offer additional support, they should be taken with the guidance of your healthcare provider to ensure they're appropriate for your specific needs. Now, I have many people coming in, and I love prebiotics and probiotics, but at certain circumstances, they are actually not recommended if you're having certain conditions at that time, right? It doesn't mean it can't be added later, but I've literally seen people in the ER because of these different issues. So that's what we want to make sure that's not happening. So that's why I offer a complimentary 15-minute clarity call with me. You're not talking to my health coach, you're talking to me, so that I can give you recommendations for certain things that we may be able to work together to go, hey, look at this, not this. Hey, look towards this way, maybe ask your doctor for this. So it's just literally, it's not a sales call, I promise. It's a chance to talk, to get a different set of eyes, to get a different perspective on something, so that I hopefully can help someone, right? This is a soulful journey for me. I swore that if I could help myself and I could find something, that I would promise that I would share the information and do my best to help as many people as I possibly can in this world. And truly, that is what I want to do. And that's why I offer this. So it's out of my time, right? All you did do is actually, if you book a call with me, show up. Don't waste my time. That's all. But feel free to call me. Here's the number, 908-335-5673, or just email me directly, abcallergy@gmail.com. And I'm happy to talk to you and see to shed some light on any symptoms or conditions or diagnoses that you have had, and shed some light on it. I thank you for your time. I hope this was worth your while, and I wish you a happy and healthy new year, everybody. Thanks. Bye.